Diabetes and smoking do not go hand in hand. Many kinds of cancers and cardiovascular diseases are linked to it. The harmful effects of smoking become exponential for those who have diabetes. The entire world observes 31st May as World No Tobacco Day, and in this edition of the Viral Mail we talk about why and how diabetes and smoking are a deadly combination. Why is smoking bad for diabetics? Those who smoke are 40% more likely to develop diabetes and are vulnerable to have more complications than non-smoking diabetics. Also, they have more trouble controlling their disease. Here is how smoking affects people with diabetes. Smoking makes controlling blood glucose levels harder because nicotine is responsible for increasing resistance to insulin. The decreased sensitivity leads to a steep rise in blood sugar, and this causes more organ damage in those with diabetes. Those who smoke have even 4 times higher risk of developing cardiovascular problems. Reduced blood flow to the heart and the brain leads to heart attacks and stroke. The reduced blood flow also affects the legs, increasing their chances of ulcers and sores, infections and even amputation. Smoking affects the lungs negatively. Those who puff away are at an increased risk of suffering from chronic bronchitis, emphysema and other breathing problems. Diabetics have a 3 times higher chance of developing pneumonia than non-smoking people with diabetes. In most cases, people with diabetes suffer vision problems causing vision problems like retinopathy, and the odds of developing cataracts and glaucoma are also higher. Smoking and diabetes accelerate severe nerve damage causes numbness, tingling, pain, and coordination problems in the arms and legs. Why diabetics find it harder to quit smoking? Most diabetics fear the weight gain that is associated with quitting smoking. However, the weight gain is negligible and is a much better side effect than all the negative issues that smoking causes. People with diabetes are also at a higher risk of developing depression. By quitting smoking, they may feel the lows to a higher degree than those who do not have diabetes. The increased stress levels stop the process of quitting and increase the consumption of tobacco. What can you do? Here are some tips to help you quit smoking. Set a date to quit. Decide on a date that you will stop smoking and do not waver. Some people prefer to quit suddenly while others may respond better to a more gradual quitting process. Decide what works best for you and work towards that goal. Share your quitting plans with friends and family. They will help you stay on the path should you find it hard to stay motivated. Telling your doctor may also bring in a factor of responsibility and accountability. Increase your inconvenience. Store away the ashtrays. Don't keep cigarettes in the house and throw away the lighters. If you must head to the stores to purchase your cigarettes, chances are you will let go of the idea. Don't act on the craving. A craving for a cigarette doesn't last for long. Practice deep breathing or meditation, or go for a bath every time you want to smoke. Avoid places and people that encourage smoking. Instead, hang out in places where smoking is not allowed. Libraries, museums, theaters, and homes of friends are good places to encourage your quitting process. Find friends who are on a quitting journey themselves. This will encourage you and keep you motivated. Improved sense of taste after quitting smoking lead to overeating, which causes the dreaded weight gain. Keep low-calorie, healthy food options to keep off the kilos, and drink lots of water. Every time you feel like smoking, exercise. You could go for a walk, a jog, do yoga, or dance instead as a healthier alternative to smoking. Exercising also reduces stress levels. Caffeine makes cigarettes taste better, so until you are sure you won't relapse, stay away from coffee and caffeinated drinks. Also, reduce your alcohol intake as it increases the urge to smoke. If you suffer from diabetes and smoke, you must realize that you are increasing your risks for many diseases. There are innumerable benefits to quitting smoking. Not only will it help you deal better with diabetes but also improve your moods and look.